You have quite a bit of experience dealing with infectious disease here. Let's start off with the fact you were on the CDC call yesterday dealing with this novel coronavirus. Can you talk to us a little bit about what it was like to sit in on that conference call and what you learned just from yesterday, the update?
It was, I think the biggest thing is there's a lot of unknowns still. And the CDC team is working quite hard to try and answer those. I think we still don't know a lot about the contagiousness of this particular virus, how long people shed the virus, so how long they might be infectious, just the degree to which it's spread from one person to another. So there are a lot of unknowns, and I think that was what I mostly took from the call, and that people are working extremely hard trying to get the answers. Part of the problem is that we only have 11 cases here in the U.S., but we've had at least one transmission from a person to another person. So we do know that it's transmitted from human to human, but how easily that happens, it's not quite clear yet.
And I think that's part of the reason why people have so many questions about this is because we don't know a lot. You have a ton of experience working in this field. Can we learn more by past outbreaks of other coronaviruses like SARS and MERS?
Yeah, I think we can, but there are different viruses. One thing we do know is they've been able to actually sequence the virus, and it's not that closely related to SARS. It's in the same group as a group of coronaviruses as SARS, but it is much more closely related to a bat, actually, coronavirus than it is to SARS. And that probably is where it originated, but that's about all we can say. It's also fairly distantly related to the standard cold viruses. There are 4 different coronaviruses we see routinely that we routinely test for respiratory infections, and the testing that we do does not pick up this virus because it's not closely related enough. So it requires special testing to find this virus. So I've had that question a lot, actually, from some families whose children have tested positive for coronavirus, because we do that testing here, and it's not the same virus. It's a distant cousin.
Okay. So, I mean, when you look at these past outbreaks that have happened in mainland China, can we learn anything from that, or is it just not similar enough to garner anything? Because right now we don't have a ton of information on this outbreak.
Well, SARS caused really a lot of very severe disease. And this virus, it's hard to know because, again, the Chinese have not been that forthcoming with information. So it's a bit hard to say. Though I think, it seems to be that the people that are most affected by this are elderly people, people with underlying disease. SARS seemed to have a broader reach in that it affected and made younger people sick. So, for example, healthcare workers became quite sick with SARS, and that became a big problem because they needed to be protected in order to take care of patients because they were also vulnerable to being infected. But this virus is so new, it's really hard to know.
You mentioned a little bit about testing. The CDC has developed testing kits right now. They have to be done at CDC headquarters. Can you talk a little bit about that, what testing might be like and how that can move forward development?
Well, CDC does this with every outbreak. They get the virus first, usually through international cooperation between countries, and then they go to work. So they went to work very quickly and developed the ability to sequence the virus so they know the important pieces of the virus, and then they can use those to make test kits. So they have done that. The problem is just to roll out test kits. They eventually probably will roll them out to health departments, probably not beyond there. When we were dealing with Zika, for example, the testing was mostly done at the CDC or at a health department. So I suspect that this will be similar in that they will use public health as the way to get testing done.
Can you talk to us a little bit about what we know about transmission and talk to us a little bit about that and how it can pertain to this outbreak?
Well, to transmit when you're asymptomatic is not unusual. In fact, most people shed viruses. Influenza, you shed oftentimes in the 24 hours before you're symptomatic. So that's pretty common. So if it's happening with this virus, that's not a big surprise. We do know that viruses can be shed from different parts of the body. What I did learn from the CDC call yesterday is that, at least from what they know, unlike SARS, where it was shed in the GI tract and people frequently had diarrhea and they had virus there, which led to transmission, it appears that this virus is not shed as much from the GI tract. I think they said they had only one person who had virus detected in the stool, and diarrhea was not a big part of this illness, at least as far as the CDC folks could determine.
Okay. So looking ahead, what do you think are the most important things that Americans need to know about transmission?
Right. Well, I think, we have 51 million cases of influenza right now, and the same things apply to influenza and this virus. If you're coughing and sneezing and you're sick, don't go to work, don't send your kids to school if they're sick, because that transmits virus, flu, or any of these viruses to other people. If you are sick, you need to cough and sneeze using appropriate cough hygiene into your elbow, essentially. If you are touching things, you should always wash your hands. People have a very bad habit of rubbing their nose, rubbing their eyes, and if they have virus on their hands, that's where it gets inoculated. So you don't need masks, because most of these viruses are spread by directly touching. You have to directly touch a surface that's contaminated, or shake hands, or use the telephone or the keyboard or whatever. So the kinds of things that are going to keep people well from flu, from coronavirus, from whatever, is washing your hands. The hand sanitizer works, but also just plain old soap and water also works. And that's probably our best defense against any of the viruses that are circulating right now, is making sure you wash your hands well.
Do we know anything about how long this virus can survive on surfaces, that kind of stuff? And is that even important?
We don't, but I think we can use other viruses as an example. On a hard surface like this that I have my hands on, they can survive a number of hours. But on softer surfaces, such as clothing or other things, the survival times are usually less. But I think the best thing to know is that, before you eat, before you rub your nose or eyes, before you do anything, wash your hands if you've been touching other surfaces.
Moving forward with this, do you foresee a vaccine coming out for this outbreak of the coronavirus, and do you think it's important?
Well, obviously, vaccines are the best way to prevent diseases. I mean, if we can do anything, that's the ideal way to prevent it. Unfortunately, the development of vaccines takes a while. Thankfully, not as long as it used to take. It used to be, like a multiple year, 5-6 year process. We do make new flu vaccines every year, so but you have to be able to know what you're making. So fortunately, there were vaccines that people were trying to develop for SARS and MERS, the Mideast respiratory syndrome virus, and they are coronaviruses. And so there are some vaccines that they are being developed at NIH and other places, where you can actually take the RNA or DNA from this new virus and insert it in place of the other coronavirus. Because what you're trying to make immunity to is, corona means crown, and they have these proteins that stick up off the surface of the virus, and they are on all the coronaviruses. So if you take the one for SARS that's on this developmental vaccine, and you take that off and you put a piece on that looks like this new virus, then you may be able to develop vaccines, and they're working on them. But the problem is that by the time you can scale up that process, oftentimes it's going to take months to a year to do that, even with the ability to know how to do it. And there are also different vaccines than we're used to. There are DNA vaccines, which requires a different kind of injection system usually, and they're different. They're just not the standard vaccines that we use.